Mezzanine. My positive calcium score came 1 week after a stress test echo, which had me rated as having the heart of a 30-year-old. I was 52.
My guess is it was not done by someone that was trained by Todd. Like you were saying earlier, garbage in, garbage out. Kind of talking about two different things here. Like the stress test and echocardiogram, which we've talked about ad nauseum, are not the best indicators. They miss a lot.
So Ari, if I could, mezzanine is not saying the CIMT is imprecise. The mezzanine is saying my cardiologist said it's imprecise, and it's unfortunately an old school cardiologist. So my BJJ, I had my first CIMT 2 weeks ago. Ari, I'd like for you to respond to this one if you would. Left is 0.66 millimeters. Right is 0.80. In a previous video report, you shared you just had one value. Are they averaged? Is it common to see discrepancy like mine?
Yes, left and right. That's why we scan both sides of the neck. It is very common to have discrepancies between the left and the right. I'm not sure who did the CIMT, so depending on what organization, sometimes their numbers are a tad bit confusing to just look at kind of as a whole. But in the previous report, you shared as one value. Are they averaged? They are not normally averaged as far as individual numbers. Like when you get your cardio risk report back, their average CCA is an average of 600 measurements. So yes, that one is averaged. But then they go beyond that and they will tell you what the largest part is. And they will also tell you if it is in fact a plaque, it will be spelled out if it's echogenic, which means it's already hard and like a cyst, or if it's soft, like the soft squishy ones, or if it's heterogeneous, where it's kind of in between the two. And that's the great thing about the cardio risk, is not only does it tell you how big it is, where it is, but it also tells you what kind it is. But yes, it is very, very common to see discrepancies from the left side to the right side. My left side looks absolutely perfect, gorgeous, not a blip in sight. My right side looks like a train wreck. So it is very, very common to see discrepancies left to right, and very important to have both sides scanned. That's why we scan both sides.